Hello, dear and constant friends and companions. Welcome to the channel, A Piece of Life Called Death. In this video, we want to talk about a very important and sensitive topic, which is suicide, and examine and understand it carefully. Suicide is a serious issue that affects many people around the world. But why do some people think about it? And how can we help them? Please stay with us until the end. And if you enjoyed it, don't forget to like and subscribe. Thank you. Suicide is an intentional act that results in the person's death. Approximately 1.5% of all deaths worldwide are due to suicide. Suicide is a complex phenomenon and can have various and complicated causes. Some of these factors include despair, mental disorders such as depression, anxiety, bipolar disorder, schizophrenia, heartbreak, alcohol addiction, drug misuse or abuse, and often stress-inducing factors such as financial problems, work problems, educational problems, or interpersonal issues such as divorce or relationship breakdown, harassment, assault, or bullying may also play a role. Suicide is condemned in Abrahamic religions such as Islam, Christianity, Judaism, and in Hindu religions such as Hinduism, Jainism, and Buddhism, and there is a negative view towards it. This act is considered a great sin and causes pain, hardship, and torment in the next world because the person has harmed their body. Suicide also includes other types where the person does not merely take their own or others' lives out of mental illness or despair and a sense of defeat. Instead, the person may be brainwashed by profiteers and with hollow promises and commit conscious suicide to achieve unclear goals. Sometimes the person wants to express their protest on a subject in the most severe form by killing themselves. Sometimes a person commits suicide or self-other killing for military purposes. Suicide is often seen as a major tragedy for families, relatives, and other close supporters, and is generally viewed negatively worldwide. According to World Health Organization statistics, a large number of people commit suicide worldwide each year. Each suicide is a tragedy that affects families, communities, and entire countries, and leaves long-term effects on people. In 2019, this phenomenon was the fourth leading cause of death among young people aged 15 to 29. Suicide does not only occur in high-income countries, but it is a global phenomenon. In fact, in 2019, more than 77% of cases occurred in countries with low and middle incomes. Suicide is a serious public health problem. However, it can be prevented with timely interventions. Suicide signs. Warning signs are not always clear and may vary from person to person. Some people make their intentions clear and say, "I want to commit suicide," or "how to commit suicide," while others keep their inclination to do so hidden. Talking about feelings of despair, entrapment, or loneliness, referring to the fact that there is no longer a reason to live. Writing a will or giving away personal belongings. Looking for easy or painless ways to commit suicide. Buying tools to harm oneself, such as weapons. Sleeping too much or too little. Overeating or undereating that leads to significant weight gain or loss. risky behaviors such as excessive alcohol and drug use, expressing anger or seeking revenge, mood swings, showing signs of severe anxiety or distress, talking about death as a salvation, negative thoughts affect mood, appetite, and sleep. Consequences. Thinking about death and attempting to kill oneself has emotional consequences. For example, a person may be so engrossed in these negative thoughts that they cannot continue their daily life. Many suicides occur suddenly in moments of crisis and can leave a person with serious or permanent consequences, such as organ failure or brain damage. Also, in those who have had unsuccessful suicide attempts, grief, anger, depression, and feelings of guilt are common. Reasons for suicide. This phenomenon has various reasons. Men and people over 45 are more likely to do this than others. Some factors, like mental health disorders, also increase the likelihood. However, more than half of those who lose their lives for this reason do not have a diagnosed mental disorder at the time of death. In fact, many suicides occur unplanned and in moments of crisis due to an inability to cope with life stresses, such as financial and family problems or chronic illnesses. Depression is the most significant risk factor for suicide, but other mental health disorders, including bipolar disorder, schizophrenia, anxiety disorder, and personality disorder, also play a role in its occurrence. Apart from mental disorders, other factors that increase the risk of this phenomenon include being imprisoned and lonely, social isolation or being harassed, history of exposure to violence or constant observation of violence, history of assault or psychological harm in childhood, job insecurity or low job satisfaction, job loss, substance use disorder, family history of suicide, attempted suicide in the past, diagnosis of a serious disease in a person, such as cancer or AIDS, suffering from chronic diseases, lack of access to treatment methods for mental disorders or substance abuse, social injuries, for example, the end of a serious relationship, difficulty in finding help and support, following belief systems that consider death as a solution to personal problems, childhood memories, suffering from certain mental or physical diseases, and environmental factors play a role in the occurrence of suicidal thoughts. Risk factors in children and adolescents. Suicide in children and adolescents can occur following stressful life events. What is serious for adolescents may seem insignificant to adults. For example, sometimes problems at school or losing a friendship make teenagers think about how to commit suicide. In some cases, children or teenagers think about death due to specific circumstances of their life that they do not want to talk about, such as suffering from a mental disorder, including depression, losing one of the close friends or family members, or having a conflict with them, history of physical or sexual abuse, being harassed, problems related to alcohol or drug use, physical or medical problems, seeing a suicide picture, reading or hearing reports related to it, or knowing peers who have died as a result of this incident. Some physical or environmental factors increase the likelihood of suicide among children and teenagers. Assessing those at risk of suicide. Mental health professionals can determine based on symptoms and personal and family history what the signs of death are and whether the risk of ending life in a person is high or not. They ask about the onset of symptoms and their frequency, the person's current or previous illnesses, and his specific family circumstances. Screening children and adolescents. Children who are inclined to commit suicide should consult an experienced psychiatrist or psychologist who has experience in diagnosing and treating children with mental health problems. In addition to the patient, the doctor should get an accurate picture of what is happening through various sources such as parents or other acquaintances. If you can't think of a solution other than suicide, it doesn't mean that there are no other solutions. It's just that you are currently unable to understand them. The severe emotional pain you are currently experiencing can impair your thinking. Therefore, seeing possible solutions to overcome problems or connecting with those who can support you becomes more difficult. Therapists, counselors, friends, or loved ones can help you see solutions that may not have been apparent to you before. Therefore, it's better to give them the opportunity to help. Treatment methods. Treatment depends on the underlying negative thoughts. In many cases, psychotherapy or talk therapy, medication, and lifestyle changes are used. Psychotherapy. Cognitive behavioral therapy, CBT, is a type of talk therapy that teaches the individual coping strategies for stressful life events. This therapy helps the individual replace negative thoughts with positive ones. Dialectical behavior therapy, DBT, is a similar method that may be used. Medication. If talk therapy is not enough to lower the risk, medication is prescribed to alleviate depression, anxiety, and obsession. Treating these issues helps to reduce or eliminate thoughts associated with death. Lifestyle changes. Sometimes, in conjunction with other treatment methods, following healthy habits can reduce the risk of suicide. For example, avoiding alcohol and drugs, regular exercise, and sufficient sleep are helpful. Professionals can identify the cause of negative thoughts by examining symptoms, health status, and the person's medication. Although it may seem like your pain and distress will never end, it's important to understand that these crises are usually temporary. Solutions are often found. Your feelings change and positive events happen unexpectedly. Remember, suicide is a permanent solution to a temporary problem. Therefore, it might be better to give yourself the necessary time to change circumstances and let the pain subside. Even for problems that seem hopeless, there are solutions. Mental and psychological issues like depression, schizophrenia, and bipolar disorder are all treatable with lifestyle changes, counseling, and medication. Most people seeking help can improve their situation and recover. Even if you have previously been treated for a mental disorder or have tried to solve your problems, know that it often takes trying various methods before finding a suitable solution or a combination of solutions. For example, when a medication is prescribed for you, finding the right dose often requires constant adjustments. Don't give up before you find the right solution. In fact, all problems are treatable and can be improved. Essential steps to deal with suicidal feelings. 1. Promise not to do anything right now. Even if you are suffering greatly now, distance yourself from any actions. Promise yourself, I will wait 24 hours and not do anything specific during this time. Or, I will wait a week. Thoughts and actions are two different things. Therefore, your thoughts about suicide do not need to become reality. There is no deadline for acting on these thoughts. No one is pressuring you to quickly act on these thoughts. So wait, and put distance between suicidal thoughts and suicide action. 2. Avoid drug and alcohol use. If you have used drugs or alcohol, suicidal thoughts can become stronger. Avoiding non-prescription drugs or alcohol when feeling hopeless or having suicidal thoughts is very important. 3. Make your home safe. Eliminate items that you might use to harm yourself, such as pills, knives, razors, or guns. If you can't do this, go somewhere where you can feel safe. If you're thinking about overdosing, give your medications to someone who can return them to you one day at a time as needed. 4. Don't continue suicidal feelings and thoughts. Many of us have found that the first step in dealing with suicidal thoughts and feelings is talking about them with someone we trust. This trusted person can be a family member, friend, therapist, clergy, teacher, family doctor, coach, or experienced counselor. Find someone you trust and tell them how bad things are. Don't let fear, shame, and embarrassment prevent you from getting help. If it seems that the first person you contacted doesn't understand the situation, find someone else. Sometimes just talking about how you got to this stage in life can take a lot of pressure off your shoulders and help you find a way to cope with it. 5. Have hope. Even people who have felt as badly as you do now have been able to recover. So, have hope. There's a very high chance that you will get through this stage and leave these feelings behind. It doesn't matter how much self-loathing, despair, or isolation you're experiencing right now. Just give yourself time and try not to deal with it alone. 6. Seek help. There are many people who want to support you during this difficult time. Even if you don't feel it right now, reach out to them. Do it right now. If you've given yourself a 24-hour or 1-week grace period, use this time to tell others what you're going through. Talk to someone who doesn't try to argue about your feelings, judge you, or just tell you to snap out of it. Find someone who can easily listen to your talks and be with you. It doesn't matter who this person is, just someone you trust and who will probably listen to you with compassion and acceptance is enough. If it seems like the first person you've connected with doesn't understand the issue, talk to someone else or call a suicide crisis helpline. Don't let one bad experience stop you from finding someone who can help you. How to cope with suicidal thoughts? Talk face-to-face with someone every day. Even if you feel withdrawn, ask trusted friends and acquaintances to spend time with you. Or call one of your friends and talk about your feelings. Set up a safety plan. Compile a set of steps you can follow during a suicide crisis. This plan should include contact numbers for your doctor or therapist, as well as friends and family members who help you in emergencies. Set a written plan for yourself every day and stick to whatever happens. As much as possible, have a regular schedule, even when your feelings are out of control. Spend at least 30 minutes a day in the sun or in nature. Exercise as much as is safe for you. Ideally, consider 30 minutes of exercise a day, but you can start with less time. 3 10-minute activities can have a positive impact on your morale. Set aside time for things that bring you joy. Even if few things currently bring you pleasure, force yourself to do things you used to enjoy. Remember your personal goals. You might want to travel to a specific place, read a specific book, have a pet, move to another place, learn a new hobby, do volunteer work, go to school, or start a family. Write down your personal goals. If you are thinking of ending your life, don't be ashamed and don't hide these thoughts. Talk to someone, and for this, you can contact friends, family, or social emergency to help you. To cope with life's pressures and prevent suicidal thoughts, it's crucial to pay attention to our mental and emotional health. This could include self-care, breathing exercises, meditation, or even consulting a specialist. To help those struggling with suicidal thoughts, we can. 1. Listen to them and refrain from judging. 2. Assure them that we are with them and they are not alone. 3. Encourage them to see a specialist and accompany them if necessary. No one is immune to life's problems, and we all may face challenges that seem daunting. But with support, guidance, and care, we can overcome these challenges and attend to our mental and physical health. Remember, you are not alone, and help is always available. If you or someone you know is struggling with suicidal thoughts, please immediately see a specialist. Thank you for staying with us until the end of the video. Please share your comments and experiences with us.